So in this series of videos, I'll explain how to get the frame into the CT scanner safely and position it in the back of the CT bay. And then in the other videos, I'll show you how to lift the frame onto the platform with the base plate and the aluminium arms and the top of the multi-axis loader. So the first step will be we close the door, and to protect the CT arm, which is inside the scanner, we want to push the arm all the way back so the magnification is reduced here, and we push it all the way back to the back where the detector is, and we can open it again and begin placing the frame in. I'm not going to show how to put the frame in on video exactly because it's difficult to do with one hand, but I will lift the frame up, I will place it here, and then I lift it over and I place it on here, and then I basically slide it into the back there. So it is possible for one person to lift the frame up and over into the CT bay. It is quite heavy, so if you require assistance, make sure you get help from somebody else when you're lifting it in to prevent lifting injuries. Once the frame is inside and on the base of the CT bay, we can then position it into the back. What's important is to avoid catching any of these pipes or cables, as they contain coolant and are important to the cone beam scanner. So yeah, essentially we want to position it so that these motors are positioned over there, and that I find is the best way to store inside at the back, because it allows us to move the motors right up over here and gives us just enough space for the actual frame to sit. So I'll rotate it around now and I'll explain how to position that. Sometimes it's preferred if you remove this piece here. This is the displacement line for the dual horizontal axis. It allows you just to get it a little bit further back when it's rotated around. So I'll show you that now. As you can see, I've begun to move the frame backwards into the storage position, and you can see how I feed the cone beam through the center of the motors, and then as I reach about 50% of that, I will then begin to rotate it again. And you can see here the dual horizontal motors have been rotated in that direction now. It's going to make it easier for us to get in there. Again, just to avoid hitting any of these important pipes, and also avoid damage to the motors or the displacement lines on the frame. If you do damage them, it's not the end of the world. We can always just solder things back on, and that's not a problem at all. So I'll show you a little bit further in the next video. So you can now see how I've directed the frame through. So I brought it round and through. Now we're past the cone. We can now guide it into its resting place. Also, what I forgot to say is it is important to have the vertical actuator in the upright position. That allows the motors to sit above the spindle for positioning the cone beam. So just make sure that you have that in pretty much the most upright position when you're positioning this in. And you can do that using the manual mode, which I discuss in the manual for controlling the system. So now you can see the frame in its storage position at the back of the CT bay. All these cables, obviously I've just lifted it in, I'm going to feed these through the port in a minute and I'll explain how to do that. But you can see how the frame sits here now. So the base of the frame goes underneath these auxiliary attachments for the CT scanner. The motors sit above the spindle, and the belt drive just sits underneath, or just sits over the top of the spindle arm. So just be careful when you're lifting it out to lift it up slightly over that spindle so that you don't damage the belt, and as well be mindful that there's not a lot of room for lifting at the base. So it's quite an awkward procedure to get out, but if you take care, it is possible to do this. In its current position, we are able to use the CT arm in its full range of motion, so all the way up to the top in its various positions. That's particularly important if the CT scanner has been off or something is reconfigured. Often you have to do an auto homing procedure where the arm moves in all positions inside the bay. So just take care that if you have to do a procedure like that, you have this in the safe position here before you do that. In terms of doing scans, obviously we're never actually that close to it, But for some smaller samples, you might get a little bit closer. So it's useful because it also allows other people to carry on their work when you're not using the frame.